was almost 1 year ago that Remy Inocencio brought us the very first news of the coronavirus.
The number of infected exploded over the weekend. The airport here in Wuhan has also started to do body temperature checks of people before they take flight. Not only that, when we landed here in Wuhan earlier today, we saw people, many of them wearing masks, taking a look at what's happening in the United States. U.S. officials want to make sure that they are raising the defenses, and that is what they are doing there, because right now, as of now, there has not been a U.S. infection as of yet.
Well, since that report, the virus has killed more than 397,000 Americans, and that number is projected to reach 500,000, 500,000, next month. In the latest CBS News poll, most Americans think vaccine distribution is moving too slowly at this time. And President-elect Biden promises 100 million vaccine doses will be given to Americans in his first 100 days in office. CBS News medical contributor Dr. David Agus joins us now. Dr. Agus, good morning to you. Let's start with that promise from the incoming Biden administration, 100 million shots in 100 days. Is that realistic?
Thank you. Good morning, Tony. Yeah, it's a bold promise, but I think an important one and a doable one. In order for that to happen, we need the AstraZeneca and the Johnson & Johnson vaccine to receive regulatory approval, because there are large stocks of them available now. And we need to step up what we're doing across the country to get vaccines from freezers into people's arms.
I don't fully understand, Dr. Agus, and maybe you can shed some light on it, why, if 31 or so million doses have been distributed, only 12 million or so have been actually put into people's arms. Why the gap?
Well, every state was given the right to make their own criteria for who to vaccinate and how to vaccinate. And many of them are having difficulty with it. They're having difficulty with the software pre-registering people so that can go smoothly. They're having difficulty following people for 15 to 30 minutes afterwards, which you have to with the 2 RNA vaccines. And, I think when they also get very, targeted in who they're going to vaccinate, it's much more difficult. Some states that have had broad criteria, everybody over the age of 65, et cetera, have had much better luck getting vaccines into people's arms. I think we're going to need a federalization. So the federal government should be in charge of distribution and who gets the vaccines and how to do it. And I think it will run much, much easier.
Yeah, it's a costly lesson to learn this late in the pandemic. So if the federal government takes a stronger approach to distributing and actually vaccinating people, what's your rough estimate for when the general population will be able to receive a vaccine?
Well, when you start to look at this, if we get these 4 vaccines onto the market, remember that the second 2, J&J and AstraZeneca, there's no 15 to 30-minute waiting time. It's not frozen. Very easy to distribute to doctors' offices, not just to the big centers in the city, but to doctors' offices across the country, which will make things happen much more efficiently. So I really believe we can do this by the summer, and that we can get 75 to 85% of Americans vaccinated, will bring us herd immunity, and then several months later, we will see a fall in the virus and getting back to a more normal way of life.
Yeah, we could all use that. We've seen in 5 weeks a leap in the death toll from 300,000 to 400,000. Now there are estimates that it could be at 500,000 by mid-February. Do you think that's a realistic outcome at this point?
Unfortunately, yes. I mean, we saw recently the peak from Christmas and New Year's where people got together, and we saw an increased number of viruses, lagged later by an increased number of deaths. It's leveled off now and slightly declining. But I think we're going to see a significant increase over the next several weeks from the mutant strains. These are strains that are much more contagious than the classic or the COVID-19 we have been fighting for the last 11 months or 12 months. And so these are much easier to spread. We're going to see an increase in those cases, and unfortunately, an increase in the death rate, which will lag the increase in cases happening next month.
All right, Dr. Agus, thank you very much. I appreciate it. Very illuminating.